usual, on behalf of the National Health Emergency Committee, the chairperson of that committee will be the Honorable Minister of Health, Dr. Ahmed usually represented. It has become customary that the Director of Health Services, Dr. Mustafa Pite, steps in and reads his statements on his behalf. In this regard, I would like to invite Dr. Mustafa Pite to present today's update on behalf of the Honorable Minister of Health. Doctor.
Thank you very much, Mr. Sankana. And good evening to you all. Once again, we're here to give the update. This is the 41st National Situation Report since the confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th of March 2020, when the country reported the first COVID-19 case. So 5 new positive cases of COVID-19 have been reported, one of the highest number of cases confirmed in a single day. Of these, 1 case was reported from Central River region, and this is the first confirmed case from that region. While 1 is epidemiologically linked to the 12th case, 3 were close contacts of the 11th case. All confirmed cases have been in quarantine and are now moved to the treatment center. Only 1 of the confirmed cases is symptomatic. Out of the 28 test results received, 5 were positive for COVID-19, 2 were probable cases, and 21 were negative. Both probable cases are also linked to the 12th case. While no new person was taken into quarantine, 2 were discharged after testing negative for COVID-19 upon completion of their quarantine period. 101 low-risk contacts are being regularly followed up to ascertain manifestation of symptoms of COVID-19. The country currently has 72 persons under quarantine, 7 active cases, and 2 probable cases. A total of 555 tests were conducted, and 17 are positive. 316 people completed quarantine, 690 contacts traced, and 310 people completed follow-ups. Globally, since the 31st December 2019 and as of 1st May 2020, a total of 3,400,323 cases of COVID-19 have been reported. Of these, 239,570 deaths were registered, and 1,081,162 recovered from the disease. Senegal so far have recorded 1,024 confirmed cases, 356 recoveries, and 9 deaths. So the daily coordination meetings are ongoing at both the strategic and technical levels. On logistics and safety, donated items for COVID-19 are being received and distribution is ongoing. The Operation Center Safety and Security Team are working with the National Security Task Force on the need for the implementation of stricter social distancing, border control, and the crackdown of people smuggling schemes into the country at sea and land entry points. On surveillance and laboratory, out of the 28 new laboratory test results received, 5 tested positive for COVID-19, 2 were probable, and 21 were negative. Both probable cases will be resampled and tested in 2 to 3 days to conclusively determine their status. On case management, 7 COVID-19 patients currently are isolated at the treatment facility. 10 sets of dignity kits supplied to COVID-19 cases at the treatment center, and plans are afoot to supply the quarantine facilities. On risk communication and community engagement, 6 TV and 11 radio programs successfully conducted, 1 press briefing also conducted, 21 communities and 872 households sensitized or engaged on COVID-19 preventive measures using existing community structures. The summary of the social media activities include 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 15,436 people. Summary of calls made to 1025. A total of 368 calls received. 351 are COVID-19 related and 17 non-COVID-19 related. 5 booked for further follow-up by contact tracing teams and 8 booked for further follow-up by the quarantine team. Regarding the next steps, the Ministry of Health will embark on the following: to ensure there is a synchronized cross-border surveillance system with Senegal, inclusion of immigration in the rapid response teams to address the issue of non-Gambians sneaking into the country, RRT to vigorously and systematically investigate and establish the possible source of infection of the new cases, conduct thorough contact tracing in the North Bank East Health Region in order to track all possible contacts of the recent case who came into the country through Farafenya. Follow up with the Supreme Islamic Council on the domestication process of Safe Ramadan guidelines on COVID-19 preventive measures. Strengthen surveillance at all points of entry, including the undesignated ones. Voluntary testing of all patients with respiratory symptoms at all health facilities. Engage private pharmacies to report clients presenting flu-like symptoms to the RRTs. Finalize SOPs on community engagement and social mobilization for social and behavioral change approaches on COVID-19. Ministry of Health and the RCCE committee to work with municipalities on the community engagement. Strengthen RRT and contact tracing teams at all regions. Establish isolation centers in all major health facilities and hospitals. And deploy newly hired health personnel to their duty stations, and also enforcement of the letter and spirit of the restriction orders contained in the state of emergency declared. Finally, as COVID-19 cases are increasing, we would like to call on the general public to be more vigilant. COVID-19 is real, and we would like to urge the general public to strictly adhere to WHO and the Ministry of Health recommendations and guidelines on COVID-19 by desisting from public gatherings and practice social distancing. Specifically, we would like to remind corridor salespersons as one-tier, shopkeepers, salons, barber shops, tailors, and general merchant dealers that the state of public emergency regulations on their business operations remain valid and will be enforced by the local government authorities and security personnel. We would like to thank the general public for increasingly using the toll-free line 1025 to report suspects, and they can continue providing valuable information to the call center. Additional helplines available include 900-1025, 622-1025, 341-1025, 344-1025, 754-1025, and 210-1025. Thank you very much, and together we can defeat COVID-19 in the Gambia.
Thank you very much, Dr. Bidel, for that elaborate update. Ladies and gentlemen of the COVID-19 media call, the floor is open for questions, both in English and local languages, as you deem convenient. Yeah.
Yeah. Doctor, lima doon laajte Abdoulaye Mendy Teranga FM. Lima doon laajte mooy new cases yi dégg ni mooy 5 cases yi dégg nañ ne bokk nañ ci ñi nga xam ne ñoo jëflante ak 11 ak 12 cases yi ñu amoon ci ginnaaw ndax loolu rek mu ngi wane tamit community transfer bi ñu doon ragal démb ba tey boobu mu ngi on oo ba tey amul dara lu ci feeñagul fu mu nekk nii loolu benn ñaareeli question bi tam ci mbiru press briefing bi police mu ngi mel ni press briefing bi buñ ko ootee ñun balaa ñoo agsi liñ fi dee ut si dañ ko dee jot balaa ñoo agsi fii muy maanaam dinañ dee dégga yenn ci ay bit information with regards to the press te at the end of the day daf dee tali ñoo nekk benn ndax lii itam du nasaxal liggéey bi ngeen nekk di def bu fekkee ne seen biir mu ngi am ay information yi nga xam ne dina dee lip laata ñu koy wax officiel for now foog naa yooyu laa amagum li ma bëgg a laajte.
ok jërëjëf si laajte bi comme cases yu ñu am ñeneent yi ni leen mun a boole ne leen mun a suñu leen seetee bu baax comme ñettay dinañ ko mun a wax ne bokk naa case 11 because soo demee into details nga seet ko daanaka benn famille bi la doom ak wife ay yooyu noonu so ñu gën a jegeeñ si taat case bi case 12 tamit kenn ki moom tamit dafa connecté ak case 12 bu ñu seetee bu baax waaye yeneen ñaari tamit yu nekk inconclusive they are connected to case 12 so loolu moo wone mooy waaw community transmission bi mu ngi am waaye suñ seetee ñu ngi def moo